So I was diagnosed with sickle cell as an infant. I've been going through a lot of pain. The adverse effects refer to like avascular necrosis, where the tip of the bone starts to die, and a lot of pain, an immeasurable amount of pain. I've had that to endure that for 39 years. My condition has caused a lot of adverse effects. I've had to endure like bilateral hip replacement and a shoulder replacement, but I'm still here, so that's a good thing.
I have sickle cell disease. I have an AVN. I did surgery on my right hip, a total hip replacement. I still get pain from that. I'm pending my left hip replacement, and managing that in itself alone, besides the sickle cell, the pain from like other places, pain every single day. I've had the AVN since I was 10 years old. I'm 34, and that was horrible. It's not a way for you to live life.
Sickle cell anemia is a genetic condition. Any kind of condition can put these patients into crisis because the red cells don't attach to oxygen enough, and it causes clogging the blood vessels basically, or break down the red blood cells. Life expectancy of these patients, if they don't get a good care and the care they deserve, it would be between 40 to 50 years old.
It's been a painful journey thus far, but since I've been getting transfusions, it's changed my life.
We do a red cell exchange where we take their sickle cells and remove them and then replace them with cells that match them, that are not damaged. That avoids them getting into crisis and having to be hospitalized for days on end, keeps them pain-free. So it makes me feel wonderful that we can be a part of allowing them to live a quality life.
We need a lot of donations, and it may not be the first choice for treating sickle cell anemia, but it's one of the choices that patients can choose with their physician the appropriate care for that specific patient based on their clinical situation.
I am so content. My life has improved tremendously as a result of these procedures, and I get to live my life, giving my kids, spending more time with them, and my quality of life is so much better as a result of it.
My transfusions last around 4 hours, and it's pain-free. You can sit, you can relax, you can eat, you can do whatever and be transfused, and at the end I am feeling like $1,000,000. I might be coming in tired, weary, and pain, but when I leave, I'm leaving like, hey, I'm here.
Everything has worked out well. I feel great every time my transfusions are done. My quality of life has changed completely. I don't have as much pain as I used to endure, and I'm able to participate in a lot of activities that I wasn't able to do prior. So I'm very thankful for the procedure. I really am.
It's like a breath of fresh air, and I'm going on a trip, and I'm so excited because it's gonna mean that I can do so much more but not being in pain this much.
Every little bit counts. My dad used to say, little drops of water make a mighty ocean. So if you can, try to donate some blood to make a big difference in people like myself's lives. We really appreciate all of that. And I can't wait to live a full life.
Being able to do exchange requires 6-7 units of blood, and sometimes we have to specifically match that blood for that patient because of some certain antibodies they have, so that they can tolerate the blood that they get. If we don't have enough of variety of blood types, then sometimes we may have to postpone the transfusion to be able to get the 6 or 7 units of blood that we need.
You're giving us just hope that we don't have to always be in pain, and that there's a light at the end of the tunnel. Please consider donating, share with your friends, because it helps. It really does help.
The impact that donors have on life of these patients, we can't even put a value for it.
We could turn somebody that's critical and on death's door, we could turn them around with whatever blood part that they need. Live stream is in the center of that, because not only do they receive the blood that's being donated, but then they also process it into the different parts, separating plasma or red cells, etc. If we could get everybody just to give, even if it's like every other month or something, that would be wonderful. Absolutely wonderful.
Some of these patients basically live in the hospital because they're in so much pain, and they keep coming, going, and nothing works for them. And when you hear that, whatever you're doing is changing the quality of their life, and they go from someone who is able to do nothing and considered disabled to someone who is an active member of society and helping someone else and doing something positive in the community. That's a big reward for a doctor or for anyone who is involved in care of these patients.
I would like to say thank you for taking the time to go donate. Your blood saves lives every day. It's made a big difference in my life personally. Every single donor out there, please continue to donate if you can. I know you don't see the instant gratification that comes from it. However, it goes a long way into changing people's lives, people like myself. And say thank you to my doctors as well. Dr. Pakbaz has been very instrumental.
Thank you to Dr. Pakbaz for a better quality of life. Thank you to the donors for helping. You may not see the effects of what you're doing, but you're saving lives. And you're giving us, people with sickle cell disease as well, a better quality of life. And I feel like I'm gonna cry because it's just changed my life so much.
We are very thankful for the hospital that made it possible for us to take care of our sickle cell patients, Life Esteem that helps us to provide the services, our donors, and our different services in our hospital.
The other nurses and I love what we do. We love our patients. We love the results we get. And that's why really everybody loves to see us. So it's a win-win for everyone.